Knee exercises, preoperative and postoperative. The following exercises are to be performed preoperatively in preparation for your total joint replacement. The same set of exercises are to be performed postoperatively to maximize your potential and improve your outcomes. Some discomfort is to be expected. If pain increases significantly, stop the exercise. All exercises should be done as tolerated to increase strength. Overdoing exercises may seem like progress while you are doing them, but the next day you may find you have an increase in pain, swelling, stiffness, and soreness. To perform your knee exercises, you will need a pillowcase or plastic bag, a rolled up blanket, pillow, or towel, and a belt, sheet, or scarf. My name is Heather Goatee. I'm a physical therapist at the Taylor Station Total Joint Therapy Clinic. This is Trevor Knowles. He's a physical therapist assistant here at the Taylor Station Total Joint Therapy Clinic, and he is going to be demonstrating some exercises for us. The first 3 exercises are meant to help promote blood circulation and reduce the risk of blood clot formation. It can be done sitting up or lying down. Trevor, I'll have you lay on your back. And the first exercise is an ankle pump. You're going to move your feet up and down comfortably from the ankles. And next we have a quad set. I want you to tighten the muscle in the front of your thigh, push the back of your knee down towards the bed, and hold for 5 seconds, and relax. And finally, we have a glute set. You're going to tighten your buttock muscles, hold for 5 seconds, and relax. And these exercises should be done 10 repetitions for every hour that you're awake. The following exercises are to be performed 2 to 3 times a day and are meant to help improve the range of motion in your operative knee. First, we'll do a heel slide. And it can be helpful to put a pillowcase over the foot to help the foot slide more freely. And using a sheet or a belt or a scarf, you'll assist with your hands in sliding your heel up towards your rear end until a stretch is felt in the front of the knee. Hold for 10 seconds and slide back down. And next we have a heel prop. Place something under the back of the heel and trying to let this leg relax, allowing the back of the knee to come down towards the bed. Over the next several days, you'll work up to staying in this position for 5 minutes at a time. The following exercises are intended to improve the strength in your operative leg and should be performed 2 to 3 times a day, beginning with 5 to 10 repetitions and increasing to 20 to 25 repetitions as tolerated or as instructed by your physician or therapist. First, we'll place a pillowcase under the foot to allow the leg to slide more freely. And you're going to slide your leg out to the side and then back to the center. Next, we'll roll up a pillow or a blanket or a towel to place behind the knee. You're going to extend your knee up and tighten your thigh muscles and control it back down. Next, we have a straight leg raise. Trevor, you'll bend your non-operative leg, tighten your thigh muscles, press the back of your knee down towards the bed, and then lift the leg from the hip. The next exercise will be performed seated in a chair or at the edge of the bed. Trevor, you're going to extend your operative knee out in front of you, tightening your thigh muscles and holding for 5 seconds, and control the leg back down. The next exercise is a chair push-up. Trevor, you're going to sit forward towards the edge of your seat. You're going to press down and straighten your arms, bringing your rear end out of the chair, and control it back down. Next is a runner's stretch. You're going to face the wall. You're going to place your operative leg a few feet behind your non-operative leg. Bend your front knee. Keep your back knee straight and your heel on the ground until a gentle stretch is felt in the back of the lower leg. Hold for 30 seconds. We would repeat this 2 to 3 times. To adjust your walker to the proper height, stand with your arms resting at your sides. The top of your walker should meet the bend in your wrist. To move from sitting to standing using your walker, you'll move forward to the edge of your seat, extending your operative leg out in front of you, and using your non-operative leg and your arms, push yourself to standing. Do not pull on your walker to stand, as it is not secure and may cause you to fall backwards. To move from standing to sitting using the walker, back up until you feel the chair against the backs of your legs. Reach back with your arms for the arms of the chair, and extending your operative leg out in front of you, lower yourself slowly to sitting. Do not pull on the walker as you sit because it is not secure and may cause you to fall. To walk with the walker, you'll push it in front of you to a comfortable distance. Step with your surgical leg first, bearing weight through your arms to unload the leg as needed as you step the opposite leg through. As you heal and your pain levels begin to decrease, you'll begin to push the walker like a shopping cart, lengthening your strides, landing on your heel in the front and pushing off your toe in the back. To size your cane appropriately, if you already have your walker sized, you can hold the cane next to your walker and adjust the height till the two match. If you do not have a walker, if you stand with your arms hanging down at your sides, the top of your cane should meet the break in your wrist. To walk with the cane, you'll place the cane on the same side as your non-operative leg. The cane will move forward as the surgical leg moves forward, stepping through with your opposite leg. Walking upstairs with a cane. Place the cane in the hand opposite the handrail and grasp the handrail with your free hand. Begin by raising the cane and your non-operative leg up to the first step. Bring your operative leg up to meet the non-operative leg. Walking downstairs with a cane. Place the cane in the hand opposite the handrail and grasp the handrail with your free hand. Begin by advancing the cane and the operative leg to the step below. Bring your non-operative leg to the same step. An easy saying to help you with the stairs is up with the good, down with the bad. If your stairs don't have a handrail, talk to your therapist before you leave for home. They will give you one-on-one instructions. To get into bed, you'll begin seated at the edge of the bed and scoot yourself back one side at a time until the knees are supported on the bed, and then moving one leg at a time to the side. You bring yourself around to a seated position, and then lie down flat. To get out of bed, you're going to push yourself up to a seated position with your arms, bringing one leg at a time around to the side, keeping the knees supported on the bed, and then scooting forward one side at a time until your feet are flat on the floor. Getting in and out of the car after a knee replacement, you'll begin by sliding the passenger seat back as far as possible and reclining it back as far as possible. You'll back up until you feel the car seat touch the back of your legs. Reaching back for your hands until you find that seat behind you, you'll bring your operative leg out in front of you. Using your non-operative leg and your arms, you're going to slide up the back of that seat as you bring the operative leg into the car. Once you've reached a seated position, you can sit up and ride home in an upright position. But to get out of the car, you'll recline the seat again, pushing with your non-operative leg and your arms up the back of the seat as you bring the operative leg out. You may leave the hospital with very limited range of motion in your knee, which is the reason you may need to slide up the back of the seat. However, if you leave the hospital with good range of motion in your knee, you may be able to omit that step. Getting into and out of the bathtub or shower with assistance. Reminder, do not take a tub bath, swim, or use a hot tub until your surgeon clears you to put your incision into water. Step 1, getting into the bathtub. Place the shower chair or bench in the tub if you feel it necessary, in case you fatigue and require a rest. Step 2, stand facing sideways to the tub or shower and place both hands on the open wall for safety and balance. Step 3, step into the tub with the leg nearest to the tub. To allow for clearance of a restricted surgical knee, lean backwards at your waist and lift the leg forward from the hip to allow adequate clearance of the leg without excessively flexing the knee and enter the tub. To accomplish this, it makes no difference whether the operative or non-operative leg enters the tub first. Have your walker readily available near the tub for proper support and safety once exiting. To exit the tub, perform the same action in reverse.